If, for example, you live in Lafayette, Louisiana, your daily newspaper may be the Acadiana Daily Advertiser. Here is the front page of the Daily Advertiser from this morning. And you see the big front page picture there. It's their A1 feature on the terrible bombing at the Kabul airport yesterday. Next to that, on the right-hand side, right-hand column, Tropical Storm Ida takes aim at Louisiana. The forecast says conditions are favorable to become a Category 3 hurricane. Again, this front page was from this morning. Forecast is now even worse. It's now looking more like a Category 4 hurricane. But even with those two big stories, really important stories on the front page, look at what's actually their top story. Above the fold, all four columns, all the way across the top. Don't take horse meds. That's their main story. Public Health Officer and Agriculture Commissioner warn against taking livestock drug for COVID-19. That is the top story today, even with everything else going on in Lafayette, Louisiana. And I have to tell you, some kind of local iteration of that story has run in more than a half dozen states in the last few days. In Mississippi, a version of that story has been front page news in multiple papers this week. We've seen iterations of the same story this week there's two of the papers in Mississippi where it's been front page, but we've also seen iterations of the same story in Kansas, in Missouri, in Alabama, in Oklahoma, in Texas, in Arkansas, in Florida, in Tennessee. Those are just ones that I happened to pull over the course of this week. I'm sure it's happening in other states too. But it raises the question, why is this happening right now? Why are all over the country, but particularly in red states that are having huge COVID surges right now, why is this thing happening? With poison control centers having to come forward and saying all of our calls now are about people taking this drug formulated for horses and cows and sheep. All of these warnings from local health officials warning against using this livestock drug or this anti-parasitic drug when formulated for humans as if it's a COVID medicine. As if it's a COVID preventive when it's not. Why is this happening everywhere right now? Yesterday, the CDC put out a national advisory on this, warning the whole country against taking this drug, ivermectin, for COVID. But also noting that lots of people in lots of states are doing it anyway. The title of this new CDC advisory is Rapid Increase in Ivermectin Prescriptions and Reports of Severe Illness Associated with Use of Products Containing Ivermectin to Prevent or Treat COVID-19. And most of this new CDC advisory is sort of technical detail about what they're observing about people misusing this drug that is properly used for deworming livestock, or in the human formulation, it's used like to kill head lice or scabies, or to treat river blindness, which is also caused by a parasite. But this new CDC advisory ends with very specific advice for the public. Be aware that ivermectin has not been proven as a way to prevent or treat COVID-19. Do not swallow ivermectin products that should be used on the skin, for example, lotions and creams, or products that are not meant for human use, such as veterinary ivermectin products. Also, seek immediate medical attention or call the Poison Control Center hotline for advice if you have taken ivermectin or a product that contains ivermectin and are having symptoms, including nausea, vomiting, abdominal pain, diarrhea, headache, blurred vision, dizziness, fast heart rate, low blood pressure. Other severe nervous system effects have been reported, including tremors, seizures, hallucinations, confusion, loss of coordination, loss of balance, decreased alertness, and coma. Yeah, be sure to call if you have taken this drug that doesn't treat COVID, but could put you in a coma. This new CDC warning follows similar warnings from the FDA much earlier in the year. Ivermectin is not approved for the prevention or treatment of COVID-19. Some of the side effects that may be associated with ivermectin include skin rash, nausea, vomiting, diarrhea, stomach pain, facial swelling, limb swelling, neurologic adverse events, including dizziness, seizures, confusion, sudden drop in blood pressure, severe skin rash, potentially requiring hospitalization, and liver injury. There's similarly dire warnings, even from the company that makes the drug in its formulation for humans. There is no scientific basis for a potential therapeutic effect against COVID-19. But those other warnings, those other cautions that this drug does nothing to protect you from getting COVID or to help you get over it if you have it, those other warnings are months old, and they haven't had a deterrent effect, particularly recently. This new CDC advisory out late yesterday is explicit about the kind of harm that's happening right now, about the rapid increase in negative consequences associated with people misusing this drug, despite all these warnings that have been out there for a long time that nobody should be dosing themselves with this thing. Again, from the CDC advisory, examples of recent significant adverse effects reported to U.S. poison control centers include the following. An adult patient presented with altered mental status after taking ivermectin tablets of unknown strength purchased on the internet. The patient reportedly took 5 tablets a day for 5 days to treat COVID-19. The patient was disoriented and had difficulty answering questions and following commands. Symptoms improved with discontinuation of ivermectin after hospital admission. Also, this is a good one. An adult drank an injectable ivermectin formulation intended for use in cattle in an attempt to prevent COVID-19 infection. This patient presented to a hospital with confusion, drowsiness, visual hallucinations, tachypnea, which is rapid breathing, also tremors. The patient recovered after being hospitalized for 9 days. 9 days. 9 days in the hospital, drinking injectable ivermectin formulated as an injection that you would shoot into a cow. 9 days in the hospital at a time when I'm sure that hospital bed wasn't needed by anybody else, right? Why is this happening now? Why is this happening now? I mean, to those poor individuals described in the CDC advisory, but why is it happening in such large numbers? What's going on right now to drive this and to put it on all these front pages all across the country, to have poison control centers in Texas, Oklahoma, Arkansas, Mississippi, Alabama, all these states coming forward just within the past week to say they're inundated with calls from Americans dosing themselves with these meds that don't treat COVID-19 and that don't prevent it. These meds that are making people sick and in some cases putting them in the hospital. It is not that this is just like getting covered now. There is a big upsurge in this happening now. Pre-pandemic, national prescriptions for this drug, ivermectin, which again does have some legitimate uses in humans for things like a bad infestation of head lice or scabies. Pre-pandemic, there were about 3,600 human prescriptions of this drug per week nationwide, about 3,600. Now, according to the CDC, for the week ending August 13th, it's not 3,600 prescriptions per week anymore. It's 88,000 prescriptions per week right now. A 24-fold increase from the pre-pandemic baseline for a drug that neither treats nor prevents COVID and can make you very sick and potentially kill you.